so excited, Michelle and I, this morning here in the living room to be sitting with the brand new president of Mercy College of Health Sciences. So we want to say good morning to Dr. Douglas J. Fiore.
Good morning.
Thank you so much for being here.
Thank you for having me.
What's
it's
going
a pleasure.
on, Perez? How are you?
I'm doing great today. Really, really well. Things are good.
Well, there was a huge event that
Yes.
happened not too long ago with
Yes.
your inauguration. Can you take us through that day and just kind of tell us a little bit about yourself?
It was literally amazing. It was a 2-day experience, but the big day, the first day, was Wednesday. It started with a mass at St. Ambrose Cathedral, and that was at 9 o'clock in the morning, officiated by Bishop Pates. But then the installation ceremony at 1 o'clock was just an unbelievable event. We had colleagues from other institutions around Iowa and other parts of the country, actually. Faculty and staff, of course, were in attendance. Lots of guests from the Des Moines community. Lieutenant Governor Gregg spoke at the inauguration, gave a little bit of a charge. So did the CEO of Mercy One Medical Center in Des Moines, Carl Keeler. My family was there. It was literally just an amazing, amazing day.
This is a huge event.
Yes, yes, it really is. It's a very, very traditional higher education experience. Inaugurations of presidents have signified, changes, new direction for the college for centuries now, really.
You're the third president of the Mercy College of Health Sciences, so kind of share with everybody where you come from and a little bit of your story.
Sure. I've been in education my whole career. I spent a bit of time in K-12 as a teacher and a principal, but when I moved into higher education maybe 15, 20 years ago, I never dreamed that I would be a college president. Went through the different ranks of the professoriate, and most recently I worked as provost and vice president of academic affairs at Park University, just outside of Kansas City, Missouri.
Okay.
And that was a wonderful experience that really helped prepare me for this opportunity.
So as you mentioned, when a new president comes in, that usually means change or new things looking forward to the future. So let's talk a little about you and what you plan on instituting, besides hanging out with the B twins there.
Yeah, I'm going to tell you what, they were the highlight.
Great, yeah.
They were truly the highlight. I know people were much more interested in seeing them than me. But Mercy College has been downtown for a long time. We've been an independent college for almost 25 years, but we've been associated with the medical center for 100 years. And lots of people don't know about us yet. We've really been Des Moines' best kept secret, and that's going to change now. Okay. We are really trying to get to become the fabric of Des Moines. We believe that we are the healthcare education provider for the city, and we see that expanding to the state as well. So we've got a lot of energy behind creating new programs, bringing our programs to other areas of the state. We're the educational center for the whole Mercy network. So everybody should be coming to Mercy College of Health Sciences to become a nurse or multiple other allied health professionals that we prepare.
Can you talk about some of those maybe new programs that people can look forward to?
Absolutely. At this point, what we've done, our newest program is our accelerated BSN program, where folks can become a BSN nurse in a much quicker time than through a traditional program. And there's accelerated BSNs are growing throughout the country. We of course know that ours is the best, and it's really priced in a great way, and it's grown dramatically. We see that kind of an accelerated mindset maybe infiltrating, if I can, some of our other programs. Don't know which ones yet, don't know which ones lend themselves to an accelerated format, but we're going to look at that. But we're open to what the healthcare community needs. We need to be responsive to the needs of the community instead of me or anybody else at the college telling people what we're going to create.
What are some of those immediate needs?
Immediate needs right now, there's a shortage of nurses, of course.
I was just going to say, are we in need of nurses?
We are, and we will be for the foreseeable future. Our nursing programs will continue to grow. We're going to move toward a graduate nursing program as well. Lots of our allied health programs, medical assistants, there's a tremendous need for those folks. But really, all of our programs, our diagnostic medical sonography program, there's needs for medical sonographers. The healthcare community is changing, and so what the programs look like may need to change in the future, but there's always going to be a need for skilled, caring employees in hospitals and clinics. And that's what we provide. That's sort of the Mercy advantage, is that compassionate piece that goes along with the skill training.
So if you're looking to go into a field where you're going to be in demand, this is a good place.
These are the ones, absolutely.
These are the ones to go for. Okay, so I know you might be a little biased by saying you're the best.
It's a little.
As you should be.
Right? As you should be. But can you explain a little bit more why are you the best? Why should people be looking at you? Or maybe if they're just saying, you know what, I've always seen you downtown, I've driven by the building, but tell me more. Why do I need to dig in a little bit deeper?
Please. The clinical placements that our students are afforded, I think, are second to none. We really have a very good stronghold, of course, throughout the Mercy network, but we have students placed in clinical environments at other health providers as well, not just Mercy. Our faculty are really what separates us, though. Our faculty have worked in the field. In addition to being highly skilled healthcare workers, they're also outstanding teachers who care about students. We're a relatively small college, so we know all of our students. We've got a wonderful academic success center to support students with tutoring, test preparation, testing itself, counseling services. So I think our size and the fact that we were originally founded by the Sisters of Mercy really allows us to be very, very compassionate and caring while still providing cutting-edge education because of great faculty and phenomenal clinical placements. We really do have it all, but we're going to continue to get better. We have to.
Mm-hmm. As you say, kind of get the word out more.
That's right.
Not only here locally, but across the state. Remind everybody kind of the turnaround. If people are looking for a change and they're saying, you know what, I need to be in a job that's more in demand, what would that turnaround be if they were looking time-wise?
You know, it depends on the program. You can complete programs in as little as a year. And then if you come to us as a student with no college experience and want to earn one of our bachelor's degrees, well, of course, then you could be with us for 4 years. But anything in between, what else we do is we start many of our programs at more than one point in the year. And we're going to be looking at having additional starts as well, so that if somebody wakes up tomorrow morning and decides they've always wanted to work in a healthcare setting, they're not going to have to sit back and say, oh, I missed the term by 11 months, so I've got to wait 11 months. You know, we're taking applications right now for summer and fall. Those classes are filling up, but we've got plenty of room and we're happy to take more students. So give us a call. Come down and visit any of our admissions counselors, talk to any of our faculty. We'd love to have as many people who want to be in the healthcare community. We'll find a way to get them educated.
Do you find that a lot of the students then are staying here local once they've graduated and got
Most of our students right now come from within a 50-mile radius and then stay in that radius. But of course, you know, we feel a special obligation to create healthcare employees for Iowa. Not every student stays in Iowa, and that's the beauty of these kinds of degrees, is they are so transferable to other places. But yes, we do provide. If you go into medical centers, hospitals, clinics, you'll typically find somebody who's been a Mercy College of Health Sciences graduate.
All right, we know the inauguration just happened not too long ago, but what are you most looking forward to, or what gets you excited about going to work now as the president?
I get excited every day. I really do. Honestly, it's the potential. You hear so many negative stories in higher education, particularly with private institutions that are struggling to find students.
True.
We offer all the degrees in all of the areas that are needed, and we're excited about what we do. So our growth is inevitable, and that's really what keeps me excited, is knowing that instead of being an educator that says, this is what we offer, we're now turning the page and saying, what do you need? That kind of listening opportunity, it's just very, very exciting.
And that enthusiasm is going to trickle down and all throughout.
That's our hope.
That's fabulous.
Love it.
So
that's our hope.
If people want to come in, they're interested, maybe, you know, start, like you said, you have they start at different times of the year and so forth. For them to find out more information, go to your website.
Go to the website, absolutely, mchs.edu, or stop by and visit us. We've got our admission staff working in our building that's right across the street from the building where my office is. So basically, if you go up 6th north toward 235, we're on both sides of the street. Stop in anywhere and we'll get you help.
Can't miss it. Stop on by, knock on the door and say,
That's right.
Hi, Prez.
Hey,
Glad to
I'd
have
love
you
to
here.
have you.
Well, we're
Love to.
so happy to
Oh,
have
yes.
you here on Iowa Live this
Congratulations.
morning.
Thank you both for having me.
We look
I've really
forward to
enjoyed it.
seeing all that you do over
Good,
there.
good.
Yeah,
I look forward to speaking with you again someday, I hope.
Wonderful, wonderful to meet you.